Dr. Sabrina Siegel with the Neuroscience Education Institute, and twice a month, I sit down with a renowned mental health care expert to discuss breakthroughs and best practices for treating patients with mental illness. In this episode, I have the privilege of interviewing Dr. Mona Massoud, general adult psychiatrist practicing in the greater Philadelphia area, and I am talking to her about how she decided to launch the physician support line in response to the COVID-19 pandemic in the hopes that this would help support mental health in our frontline healthcare workers. Welcome, Dr. Massoud.
Thank you so much for having me.
Dr. Massoud, what are some of the issues that healthcare providers, especially those on the front lines, have been facing in the midst of the COVID-19 pandemic?
So, it's interesting. It's actually been evolving as the COVID-19 pandemic has been evolving as well. And the same kind of uncertainty that the public outside of the healthcare realm was dealing with in terms of their anxieties of what is yet to come. Am I going to be impacted by COVID? And what is that going to even look like in terms of my own physical health, as well as my own family's physical health? What is my job security going to look like? Am I even prepared for this? People are looking at me for answers. And do I even have them myself? Because this is such a new adversary that we're fighting here. And so it kind of started off like that in terms of what we call anticipatory anxiety of the unknown. And then after that, it kind of evolved into now I'm in the thick of it. I can't process if I lose a patient or if I'm losing a coworker even. I don't even have time to process what that is like or that loss. And then it's moving on into, well, I think I have not dealt with what I have experienced. So I'm a little bit worried about if there's going to be a second surge. And there is a bit of that post-traumatic stress we see from people who have encountered such huge trauma.
Mm-hmm. What is the physician support line and how did you get the idea to create this?
So the physician support line is intentionally peer-to-peer support line run through a toll-free number that is run by over 700 volunteer psychiatrists who kind of just band together completely grassroots in the common mission and vision to support their physician colleagues on the front lines, but also the ones that are just trying to navigate their profession and their regular day-to-day life intersection during the COVID-19 pandemic. So that's the physician support line in what it does. But the way that it actually came to me, it really came as a, if not me, then who kind of attitude. We're having the opportunity to see that silver lining during COVID-19, where a lot of people are just kind of stepping up in the way that is a very individual effort. We're not waiting for permission from people. We're not navigating our goals and our aspirations from the usual ways of asking permission and working through different already established systems. We're just kind of going out there and putting out our ideas and trying to do whatever we can to help one another get through this. Similarly, for me, I was already a practicing psychiatrist. I continue to see my own patients during this crisis as well. And I'm also a moderator of a COVID-19 physician group, which is made up of several tens of thousands of physicians worldwide, also got together in order to share relevant clinical information that would help us navigate the COVID-19 pandemic. And so while I was moderating that group and approving and vetting different posts that were coming through, I kept seeing posts on personal mental health, and specifically that people were not doing so well. They were starting to talk about, do I myself keep a DNR? Do I spare my family that decision? Do I go ahead and get a will done? And hey guys, are you guys still wanting to be in medicine? Are any of you also having this desperate need to escape? And are you guys feeling like cowards? Everyone's calling us heroes, but does anybody else feel like a coward? And when I started seeing those kind of posts, it was very obvious that something needed to be done about it. Yeah. And one day on that whim, I just put out a post in that same group saying, calling all psychiatrists, who's with me? I'm thinking about starting a support line for physicians. And the response was tremendous, Sabrina. So yeah, first it started with 50 people, then it went to 100, and now we're over 700 volunteers.
That's incredible. That is so inspiring. And I love how you started it. You know, we hear so many negative things about social media, but it's so inspiring when something really positive comes from that.
Absolutely.
So what happened when you initially asked for these volunteers to help with the hotline? I know you mentioned the numbers in terms of how quickly it increased, but what was the response like?
So for psychiatrists, similarly to other physicians, we're trained to look for risk factors in the ailments that we treat. And for us, when people are starting to talk about what we call escape fantasies of not wanting to be here or not feeling invested in their life, not feeling motivated, the isolation was already there due to COVID itself, but especially more so for healthcare workers because they're in the thick of it. A lot of them were fearful of going home. And so they're isolating themselves from their support systems. And these are very huge risk factors in terms of depression and anxiety and post-traumatic stress. And as doctors ourselves, it was writing on the wall. We had to either act now or things were going to get way worse.
Right, right. So how many calls do you receive a day, and what are some of the issues that healthcare providers have been faced with?
In terms of the calls received per day, our numbers vary depending on the different kind of things that are happening in real time. For example, it can range anywhere from like 10 to 40 calls a day. Our service is nationwide, so we have all states and even Puerto Rico represented in terms of who calls into the line. So it varies based on the kind of difficulties that we're seeing. Dr. Breen from New York, she was a very well-known and respected ER physician there. And she had committed suicide about a month ago. And it really hit home for so many of us. Even if we've maybe never had suicidal thinking, we all very surreally understood how it could get there.
Right.
Yeah.
Yeah.
And so the response after that on the line was huge, where people were just voicing that concern of how am I protected? What can I do? I can't let myself get there. I don't want to get there, but I'm so worried that we're all heading in that direction because we're so overwhelmed and burnt out. And so those kind of events made bigger surges of calls. So we kind of have balanced out in a steady pace now. And what were you saying, Sabrina, the follow-up?
You know, what were some of those issues that the healthcare providers were being faced with, especially those on the front lines? And I think what you touched on was so important to note that it's not always the same. There's different issues. And as this whole situation has evolved, there have been different issues. And I think probably one of the most difficult ones was the suicide that occurred. And that's not the only one. But for most people, I think that was very shaking.
Yeah.
And it's so amazing that there was this service that was in place at that point that was able to support so many people and help them to get through that time. And then now I think it's been changing sort of the face of the pandemic, and the things people are concerned about now are not necessarily what we were concerned about in the beginning.
Exactly.
But yet it's all involving mental health. We definitely wanted to get this information out there as soon as possible so that other providers would be able to use this service if they didn't know about it.
Exactly. And I thank you for that and for that advocacy again, Sabrina. And you're right. What we are noticing and what we have noticed throughout this 2-month period of time that we've been live regarding physician mental health through the support line is that it was timely for COVID right now, but there is so much that our callers talk about that are often very much unrelated to COVID. And it's telling to us, and it has pushed us to make this a sustainable resource even after COVID.
Oh, that's wonderful.
Yeah.
That's excellent to hear that, because I was going to ask that. And, you know, there really are so many silver linings when I think about what's happened, in that, if nothing else, it's raised awareness about how much more we could be doing for each other and how much more we could be supporting one another. Unfortunately, it's a difficult situation that inspired this type of support. But now that it's in place, it's wonderful to see that it would still stay in place and that it could be a resource for so many. So thank you for that.
Absolutely.
Now, what type of training did volunteers go through to deal with the psychological trauma of this pandemic? Because as you noted, that wasn't everyone's specialty prior to this.
That's exactly right. So we are all psychiatrists, and we purposely modeled the support line to be run by psychiatrists because of the timely nature of what the work we needed to do. We needed to be able to lift off very quickly because we were already in the thick of this crisis. And so psychiatrists, we already have that training built in, as well as the fact that we are physicians ourselves. So we have the shared experience of the people who are calling us, which really is helpful because they do not have to explain themselves and explain what is the struggle that I'm having as a physician right now. They could just launch into the specific issue that they wanted to discuss and work through because they're talking to colleagues. But at the same time, we also have various therapeutic modalities that we were able to employ in real time with our callers. That being said, in terms of our further training that we did, and more along the lines of refresher courses, is that we have weekly seminars that are offered to us pro bono by renowned psychiatric and psychological institutes nationwide. And we reach out to these amazing activists and scholars and physicians and just different people who have been pioneers in the fields of crisis management and motivational interviewing and psychological first aid, etc. And they have been giving us virtual courses specifically geared towards this support line type of work that we're doing, specifically geared towards providing mental health support to physicians and healthcare workers. And we do it every week. So that's been really valuable to all of our volunteers, which again, it is a free resource for all of them. And if they can't attend live, we do record it and have it available to them in their volunteer portal.
That's great. That is so inspiring. I think that's such a great approach. So you did just touch on this a little bit, but how is addressing mental health concerns with colleagues different than addressing mental health concerns in patients? It's kind of a different community, right?
Yes, exactly, Sabrina. Thank you for kind of pointing out that nuance. It is very different. So how the physician support line works is that we have emphasized to our volunteers that we are not in a doctor-patient relationship. We are not prescribing medications. We are not coming up with treatment plans. We are not going to be having continuity of care with the people that we're talking to. Our goal here is peer support, which is very different. Of course, we will be using some elements such as what we call Socratic questioning, meaning encouraging the person we're talking to be their own advocate, empowering them to come up with their own solutions, and us kind of just serving as guides and peers. And so we do emphasize that because our role here is in the end to send them back out into their work and into their life, and that we are there to kind of really just provide a safe space, a safe holding space. They can tell us anything they want. There's no fear of any sort of repercussion or reporting. We are honestly acting as people who have the shared experience, but people who are also your friends, people who are there to kind of give you safety. And then when you feel grounded again, to let you go.
Right, right. It's a beautiful thing. Now, what has been some of the most common pandemic-related stressors that physicians have been calling about or providers have been calling about? And how have these changed over the course of the pandemic? We talked a little bit about this, but could you share a little more with us?
Sure, absolutely. So what's COVID related has evolved, like you were mentioning. At the beginning, it was about, if I get it, what will happen? And not just what will happen to me. That was actually, interestingly enough, on the back burner and kind of telling about the self-sacrificial psychology of physicians and healthcare workers, that they weren't really caring about what would necessarily happen to them. They were more worried about what it would mean in terms of their families, as well as their patients, and as well as actually their coworkers. A lot of them would be talking about if I get sick, then, I'm much younger than my colleague who's in the range that if they got COVID, then God forbid something worse could happen. What happens if they ended up on a vent? I could never get COVID because I could never have them come in. And so they were going out of their way, a lot of these physicians who were younger or felt that they should be the one who took the hit rather than their mentors or other people more vulnerable. And so then it went from that, and then it evolved into, I am losing patients at a rate that I never thought I would. I am seeing 8 to 10 deaths a day. And not only am I not used to seeing that, but I feel like I failed somehow, that everything that I'm doing, it's pointless. And the helplessness that COVID brought up in physicians was horrific. And it was very hard, even as doctors ourselves, to convince one another that they are not at fault. We feel as physicians really that if we can't help, who will? And so we feel like we're in the front lines, but we're also the only line of defense. Right. And that was a very hard feeling for people, specifically physicians, to navigate. And then, as I was mentioning before, Sabrina, a very common thing we're getting right now is unprocessed grief. They're saying that they're losing people and they're feeling like they failed. But in that, it's very different than the fact that they're not even able to grieve for the ones that they have lost.
Right.
Yeah. They just have to get back into it. Tomorrow's another day. Tomorrow I have to check on this person on this vent or this person that is crashing or etc. So things are unprocessed, and we try as much as we can to get them to stay in the present when they call us, because we know they're getting back into the battlefield. But one of the reasons I was saying all the volunteers feel the necessity of the physician support line being a sustainable resource after COVID is because it's not over. Mental health of everyone, but especially people such as first responders and physicians, it is going to go on for some time. There's going to be post-traumatic issues that come up.
Right, absolutely. Now, when people call in, what sorts of resources do the people on the support line provide callers with?
Mm-hmm. So we see ourselves kind of like triage, meaning we are the ones who first receive the callers and we introduce them to what wellness could even feel like. Look at how you being vulnerable actually helped heal you a little bit. Isn't this worth keeping sustainable for yourself? And a lot of our callers will tell us they've never actually talked about their mental health. They've never thought that they were worthy or deserved to. They're strangely apologetic about even using a resource that was specifically made for them.
Wow.
Yeah. And these kind of things are when they're finally allowing themselves to talk about their humanity and that they are, in fact, not heroes, but humans underneath all of this expectation of the world and the media of what physicians are supposed to be right now. When they realize that they can be human and that they should allow themselves to, they are like, what's next? What else can I do? This is such a game changer. I need this to never be sidelined again. And we give them a whole lot of different resources. And just to kind of tell you, it depends on what they're looking for. If they're like, oh, I need something that is a quick thing that I can just pull up on my phone, like an app that'll help me, then we recommend things like 10% Happier or Headspace, which are apps that are free for healthcare workers right now. And if they're like, no, I feel like this is just the tip of the iceberg, I have so much more to unpack, and I really need to get into a therapeutic relationship, then there are pro bono counseling services for healthcare workers there right now through telehealth platforms such as projectparachute.org. We refer them to that. Or there's one that is specifically geared towards physicians called physicianmentalhealth.com, and we send them that way. Also, Sabrina, we actually tell them, if you ever need that holding space again, we're here. Call us again. You don't have a limit on how many calls you can make to the support line.
That's wonderful, because I think even that right there, if someone is just beginning to work on their mental health, knowing that support line is still there could just make the difference between them taking the next step and making a commitment to take care of their own mental health. So
exactly.
That's so powerful, really powerful. So with that being said, that actually leads me to my final question, which is, how can healthcare providers protect their own mental health, especially during a time like this? And how does this hotline provide support for one another? Not just this hotline, but things like this. What types of things can help to sustain this support for one another to protect mental health in the medical community?
Right. I think what we're hoping this is unlocking for everyone, the silver lining, like you were mentioning before, is that it is normalizing physician mental health, that actually we are all going through major emotional upheavals because of what we do. And we deserve wellness. And if we are preaching compassion to our patients and we are expected to be there and hold their hands and encourage them to take care of themselves, we have to practice what we preach for ourselves. And it can't be a one-way street. Having answers for others or being in the role of healing someone else does not mean that you go unhealed. I guess the catchphrase we're telling everyone, and one that I've been telling my patients way prior to COVID who have these kind of issues of self-sacrifice or equating selflessness as self-sacrifice, I often tell them, you don't have to set yourself on fire to keep others warm.
Wow. That's so powerful. I love that.
Yeah, it speaks to me too. It resonates with me too, because I think inadvertently we do it, that we all get into that zone where we really do think that if we are helping others, we have to do it at our own cost. But we really don't. There is room for wellness for everyone.
Absolutely. Well, thank you so much, Dr. Masood. Thank you for all of that timely and important information. And thank you for being on our show.
Absolutely, Sabrina. Thank you again for hosting me.
This podcast was brought to you by NEI membership. You're busy caring for your patients, and you might not have time to keep up with the ever-changing treatments in mental health care. You don't have to. NEI membership includes regular psychiatric news updates, CME activities on the hottest topics, and the most cutting-edge prescribing app available today. To learn more, visit the link provided in the podcast description.